Hello. Our topic today is role of vitamins in CNS disorder. Okay. Now we will have a brief overview as to what vitamins were. Vitamin, as we all know, are nutrients that our body does not make on its own. So we must obtain them from foods that we eat. And if not that, then we can have them through the supplement of vitamins. Okay. And they're very essential in overall good health. Okay. Now, talking about the classification of vitamins, we have fat soluble vitamins and water soluble vitamins. In fat soluble vitamins, we have vitamin A, vitamin D, vitamin E, and vitamin K. Now, moving on to water soluble vitamin, we have B complex and non B complex vitamins. In B complex, we have B1, B2, B3, folic acid, which is B9, and B12. Apart from it, B6, which is pyridoxine. In non-B complex, we only have one vitamin, water soluble, which is vitamin C. We will start off by vitamin B1. Another name for vitamin B1 is thiamine. Okay. Now talking about the structure of vitamin B1, which is thiamine. Okay. It is composed of pyridine and thiazole ring, as you can appreciate from the picture here. Now, thiamine, I have mentioned earlier, it is also called vitamin B1. Okay. And it contains the pyrimidine ring and a thiazole ring. And the active form is thiamine pyrophosphate. And its activation mainly takes place in the liver. Now, talking about sources, what are the sources? It is mostly found in nuts, seeds, brown rice, seafood, and whole grain products. Okay? Sunflower seeds are particularly a good source. Apart from it, we have whole wheat, bread, milk, beef, and beef livers. Now, what is the daily required amount? It basically depends on the number of calories in diet. 1.2 milligrams in male and 1.1 milligrams in female. And in pregnancy, the demands increase and it goes up to 1.5 milligram in pregnancy. Okay. And daily requirement, as mentioned earlier, will increase with higher carbohydrate intake. मतलब carbohydrate intake अगर increase हो जाएगा तो daily requirement will also increase. Okay. Now, what is the role of thiamine? It is a cofactor for carbohydrate metabolism. Okay. And because of this role, it will enable blood sugar conversion into biological energy. Okay. Basically करेगा क्या ये जो हमारे पास blood sugar है which is glucose, it will convert that into biological energy. And this energy will be important for the following things: for providing energy to the brain, for improvement of transmission of nerve impulses through nerve, by providing them with energy, and apart from it, proper function of the heart muscle in the mucous membrane, and maintenance of smooth and skeletal muscle and formation of RBC. Now, thiamine, I'm talking about biochemical function. Thiamine pyrophosphate is involved. What was thiamine pyrophosphate? It was the activated form of thiamine. Okay, it is involved in the energy releasing reactions of carbohydrate metabolism. Okay, as you can appreciate from the picture here, when pyruvate is converted into acetyl CoA, there is a role of thiamine there. Then when alpha ketoglutarate is converted into succinyl CoA, we have role of thiamine there as well. Now, what are the causes of deficiency? Basically, inadequate diet, which is rich in thiamine, which could be due to polished rice. Okay. Why polished rice? जो outer layer होती है of any rice or grain, उसी के अंदर हमारे पास थायमिन होता है, राइट? एंड इफ इट्स पॉलिश्ड राइस, वो आउटर लेयर हमने हटा दी, इसकी वजह से तो उस वजह से thiamine भी obviously remove हो गया. Because of that reason, we have thiamine deficiency. Apart from it, alcoholism again would hinder with the absorption of all water-soluble vitamins. So that will also lead to the deficiency. And in pregnancy and lactation, one could also face deficiency. Why? Because in pregnancy and lactation, the overall demand of the body for thiamine will increase. Okay. Also because of the presence of enzyme thiaminase, which is there in raw fish, it will activate thiamine. Okay, by altering its structure, by breaking the thiazole ring. Now, basically, thiamine deficiency जो होती है, mostly it is in those who only consume polished rice. Okay. Now, deficiency अगर बहुत लंबे अरसे तक कंसिस्ट करे तो it will lead to a condition known as beriberi. Now, beriberi is further classified into three types: wet beriberi, dry beriberi, and infantile beriberi. In wet beriberi, it is characterized by edema and weak heart muscle. In dry beriberi, we have degeneration of the peripheral nerve and weak muscles. And in infantile beriberi, as the name suggests, it affects infants. Now there is a syndrome, Wernicke-Korsakoff syndrome. It will result if beriberi is not treated. Okay, what happens in this Wernicke-Korsakoff syndrome? It is characterized by confusion, disorientation, inability to speak, numbness and tingling of the extremities, edema, nausea, vomiting, visual difficulties, and it may also lead to psychosis, coma, and ultimately death. And again, this is a reversible condition. Why was it taking place? It was taking place because of deficiency of vitamin B1. But if B1 again administer कर दिया जाए particular patient को उसके level normal पर आ जाए, then this condition is reversed. Now moving on to the next vitamin, which is folic acid. Folic acid is also known as vitamin B9. Okay, folic acid consists of pyridine nucleus, C-aminobenzoic acid, and glutamate. Okay, you can appreciate the structure from this image. Now, folic acid itself, what we consume in food, is not biologically active. Okay, basically, its active form is tetrahydrofolate. Talking about absorption, folic acid that we consume in diet, it is mostly in the form of polyglutamate, okay, with 3,7-glutamate residues. And in this polyglutamate form, it is not absorbed in the intestine. So we have to break it down into more simpler form. Okay, polyglutamate form के अंदर absorb नहीं होता. तो basically हमारे intestine के अंदर enzymes होते हैं जो कि ग्लूटामेट साइड चेन को क्लीव कर देंगे. एंड एंजाइम का नाम है फोलेट कॉन्जुगेट एंड पॉलीग्लूटामेट हाइड्रोलेज. And as mentioned earlier, polyglutamate form के अंदर absorb नहीं हो सकता. Only monoglutamyl form of folic acid is absorbed. Okay, once it is cleaved, polyglutamate form of folic acid is broken down into simpler form, which is monoglutamyl form of folic acid. Then in that form, it can be absorbed. Now tetrahydrofolate acts as a coenzyme for these three reactions. Mucopoiesin, which is the formation of the white blood cell, erythropoietin, which is the formation of the red blood cell, and nucleoprotein cell. Now, what is the role of folic acid in the body? Again, various forms of folic acid, they function as a single carbon donor receptor in a variety of biosynthetic reactions. And what are those biosynthetic reactions? One is synthesis of methionine, then pyrimidine synthesis, purine synthesis, conversion of serine into glycine, and histidine catabolism. Okay. Now, what is the RDA, recommended dietary allowance per day? In men, we have 200 micrograms per day. In women, we have 200 micrograms per day. In pregnancy, as we can see, it has gone up till 500 micrograms per day. In lactation, also from 200, it has gone up to 300 micrograms per day. And in children, the RDA is 80 to 120 micrograms per day. Now, talking about the natural sources, we have dark leafy greens, broccoli, spinach, asparagus, and liver, fortified breakfast cereal, citrus fruits, lentils, and whole grain. Now, talking about deficiency, deficiency is very rare and primarily is due to malabsorption, which is due to alcoholism. As mentioned earlier, alcohol will hinder the absorption. Okay, for that matter, malabsorption could be due to alcoholism or impaired hepatic function. And those impaired hepatic function will also be due to alcoholism. Okay, and what will it lead to? It will lead to glossitis, which is the inflammation of the tongue, megaloblastic anemia, which is a type of anemia, leukopenia, and neural tube defect. Now, as you can see from the picture here, we have a normal marrow on the left hand side, which you can see the erythroid cell size is normal. And on the right hand side in the megaloblastic marrow, you can see that the erythroid cell size is pretty large as compared to the normal marrow. Now, as far as laboratory findings are concerned, peripheral smear will show macrocytic hypochromic anemia, macrocytic hyperchromic anemia, okay, and hypersegmented neutrophil, which is a common finding in megaloblastic anemia. Bone marrow shows megaloblastic changes characterized by abnormally large size of erythroid cell, which we have seen in the last image or the image before that. Okay, and because of this reason, there will be defective red cell production. Red cell की production जो है, which will no longer be normal. Defective red cell production will be basically. Now, what are neural tube defects? Basically, birth defects होते हैं which occur in early pregnancy. A female who is pregnant, अगर उसके अंदर हमारे पास फोलिक एसिड की deficiency आ जाएगी, तो जो developing embryo है, उसके अंदर defects होते हैं, right? Those are neural tube defects. अब basically neural tube जो grow करती है embryologically, ultimately it becomes into the baby's spinal cord, spine, brain, and skull. So now, most common neural tube defects हमारे पास कौन-कौन से हैं? Spina bifida is the most common one. Okay, it is a condition which results when the lower part of the neural tube fails to develop properly. अगर proper development नहीं हो पाएगी lower part of the neural tube, तो हमारे पास spina bifida होगा, right? Spina bifida is further like classified into three types: occulta, in which there will be an opening in the vertebral column lower end. Okay, in meningocele, from that abnormal opening, the meninges will pop out. That will be meningocele. And myomeningocele और meningomyocele है जब उसी abnormal जो lower end of the vertebra है वहाँ एक abnormal opening है, उसके through जब meninges के साथ साथ हमारे पास spinal nerves भी आने लग जाएंगी, okay, then that is called myelomeningocele. Now the other one is anencephaly. What happens in anencephaly is it is a fatal condition in which upper end of the neural tube it fails to close. As you can see here, this is the picture of spina bifida. Again, this is spina bifida, in which you can also see the spinal cord, spinal fluid, and dura mater. So basically, this is meningomyocele. Folic acid and homocystinemia. Homocysteine, as we all know, is a risk factor for coronary heart disease. Okay, and folic acid is required for the conversion of homocysteine to methionine. And let's say folic acid की deficiency हो गई है, तो ये homocysteine जो है body में accumulate कर जाएगा, which will result to homocystinemia. Okay, and as we all know, homocysteine is risk factor for coronary heart disease. So what we can do in this condition is we can give the patient folic acid supplementation, which will decrease the plasma level of homocysteine. Now, why is folic acid so important? Because it will reduce the risk of neural tube defects by 70%. Okay, and other birth defects such as cleft lip, cleft palate, and certain heart abnormalities in the developing fetus. Now, who is at higher risk? Basically, women जिनके पास previous pregnancy के अंदर भी neural tube develop हो चुका है, they are at higher risk. Apart from it, females who have family history of neural tube defects, they are also at risk. And then females who use certain anti-seizure medication or have insulin-dependent diabetes or who have been clinically diagnosed as obese or females who have history of alcohol abuse, okay, and certain northern Chinese or Sikh heritage women are also at risk. Now talking about vitamin B12. B12, talk about it structurally. It is the most chemically complex of all vitamins. Structure of vitamin is based on a corrin ring, okay, which is similar to a porphyrin ring in heme. Okay, the central metal ion is cobalt, and there are 4 types of vitamin B12. Okay, depending on different groups. If cyano group is attached to it, it is called cyanocobalamin. If hydroxyl group is attached to it, it is called hydroxycobalamin. If methyl group is attached to it, it is called methylcobalamin. If 5-adenosyl group is attached to it, it is called adenosylcobalamin. Here's an example of adenosylcobalamin. Now moving on to vitamin B12 sources. Fortified breakfast cereal to some extent. And as we all know, B12 is not present in vegetables. Okay, so food that is in animal form, which could be fish, meat, poultry, eggs, and milk, are rich in vitamin B12. Okay. Now, this part is really important. Vitamin B12, when we consume that in food, it is bound to a protein. When it reaches to the stomach, uh, hydrochloric acid that is there in the stomach will release vitamin B12 from that protein. Then we have free vitamin B12 in the stomach, right? But in order for it to absorb from the intestine, it needs another protein which is called the intrinsic factor. And this intrinsic factor is released from the gastric parietal cell. So जब ये intrinsic factor से bound हो जाएगा, then it gets absorbed from the intestine. Okay. Now, what is the role of B12? It is essential for the maturation of RBCs, and it also protects against pernicious anemia. It is essential for the growth and reproduction of cells, and it is also essential for the formation of myelin and nucleoprotein. Now, vitamin B12 is required as a coenzyme for 2 metabolic reactions. One is isomerization of L-methylmalonyl-CoA to succinyl-CoA, which is an important substrate of hemoglobin synthesis. The second is methylation of homocysteine to methionine. This step is important in intracellular synthesis of folate coenzyme. Now, required daily amount 2.4 micrograms per day, and it increases to 2.6 micrograms per day during pregnancy. What are the causes of deficiency? One is vegetarians who do not consume any animal products, as mentioned earlier when we were discussing sources. Animal sources are very rich, animal and dairy sources are very rich in vitamin B12. Okay, so anyone who is a vegetarian can develop deficiency of vitamin B12. Similarly, stomach or intestinal disorder are also linked with the deficiency, because if there is any uh, hindrance in absorption of vitamin B12, which could be due to inadequate intrinsic factors, okay, that will also lead to deficiency of vitamin B12. Now, what are symptoms of vitamin B12 deficiency? Pernicious anemia. What exactly is pernicious anemia? It is a type of megaloblastic anemia and it is caused by loss of gastric parietal cells. And as we all know, gastric parietal cells क्या कर रहे थे हमें intrinsic factor दे रहे थे, which was important for vitamin B12 absorption in the ileum. Okay. Apart from it, neurological changes B12 deficiency में हो सकते हैं, like numbness and tingling in hand and feet, demyelination and irreversible nerve cell death. Okay. Apart from it, difficulty in maintaining balance, depression, confusion, dementia, poor memory. Okay. And in infants, one can have movement disorder and delayed development. Now, how is vitamin? Okay. So how can we use folic acid? Hold on a second. Yes. Now, what are the uses of B12? Large doses can be given in cases of cyanide poisoning. Okay. If you give large IV doses of B12 in the form of hydroxycobalamin in the case of cyanide poisoning, so this hydroxycobalamin would combine with cyanide and it will convert to a harmless form of vitamin B12. Okay. And B12 can also be given in combination with folic acid to treat megaloblastic anemia. Okay. And let's say patients who are vegetarian or who have deficiency vitamin B12 due to other reasons, you can also give them supplements of vitamin B12. Moving on to B6. Another name for B6 is pyridoxine. Okay. So collectively, B6 represents three compounds: pyridoxine, pyridoxal, and pyridoxamine. Okay. And structurally speaking, they're all pyridine derivatives. Okay. Active coenzyme form of B6 is pyridoxal phosphate. Okay. PLP or pyridoxal phosphate is the active coenzyme form of B6. Okay. And ये synthesized किससे हो रही है? ये synthesized हो रही है from the above mentioned three forms: pyridoxine, pyridoxamine, and pyridoxal. Okay. As mentioned earlier, pyridoxal phosphate the active coenzyme form of vitamin B6, and it is closely associated with the metabolism of amino acids with transamination, decarboxylation, heme synthesis, deamination, and production of niacin. Now, what is the role? B6 is needed for more than 100 enzymes involved in protein metabolism. Okay, it is also essential for red blood cell formation and hemoglobin formation. It is also important for nervous system and immune system to function efficiently. It is also needed for conversion of tryptophan to niacin. B6 also helps in maintaining blood glucose level within a normal range. Okay, जब कैलोरिक इंटेक हमारे पास काफी लो हो जाएगा, तो जो स्टोर्ड कार्बोहाइड्रेट है उसको B6 जो है वो हेल्प करता है कन्वर्ट करने के अंदर इनटू glucose in order to maintain normal blood glucose level. It also has an important in steroid hormone action. It is also part of the molecule glycogen metabolism. It is also used as drugs जब किसी हम पेशेंट को suffering from tuberculosis उसे हम जब एंटी ट्यूबरकुलस ड्रग्स दे रहे होते हैं, so along with that we also give them vitamin B6 pyridoxine to counter morning sickness and muscle dystrophy. It also acts as a coenzyme for the following transaminases, transsulfuration reaction, deamination of hydroxyamino acid, and interconversion of glycine to serine, and conversion of tryptophan to niacin, and synthesis of sphingosine from serine, and coenzyme for ALA synthase in synthesis of heme. Now, what are the sources? In plant sources, we have yeast, legumes, whole grains, cereals, and vegetables. And in animal, we have liver, muscle, and meat. Now talking about the required daily amount, 1.3 grams per male till the age of 50, 1.7 for males older than 50, 1.3 milligram per day for female till 50, and 1.5 milligram per day for adult female older than 50. Okay. So basically with age, its required daily amount is increasing, and also during pregnancy and lactation. Now, what are the causes of deficiency of vitamin B6? Individual with poor diet or an inadequate B6 intake. Okay, alcoholics, as we all know, alcohol hinders the absorption of water soluble vitamins. Okay, also in older people and asthmatic children which are treated with theophylline. Okay, because theophylline decreases the body stores of vitamin B6. What are the signs of B6 deficiency? Dermatitis, stomatitis, and glossitis. Apart from it, neurological abnormalities like depression, confusion, and convulsion. And B6 deficiency can also cause anemia. What are the side effects? Although toxicity of B6 is very rare, but if you consume very large amount of B6, it can cause nerve damage to the arms and legs. And so in order to counter that, you need to monitor the amount of B6 you're taking. And जो भी damage हुई है to the arms and legs, if you stop that at once, the damage would be reversible. Okay, that will be all regarding role of vitamin C in its disorder. Okay. Thank you.